Sub-Saharan Africa has one of the largest energy access gaps on the planet, as less than half of the region's population has access to reliable electricity. This is not only a problem for households, but extends to civic life, where hospitals, schools, and other essential services lack reliable electricity. To address the COVID-19 pandemic, hospitals and health clinics will require high-quality electricity service more than ever. Green Street Africa is an innovative approach to build distributed solar energy for public facilities. While grant funds exist for solar energy installation, many grant-funded systems fail because of a lack of funds for ongoing operations and maintenance. Additional barriers include high upfront cost, minimal investor engagement, and lack of interest from service providers. Green Street addresses these issues by working with local public agencies to develop portfolios of distributed solar projects that provide an attractive investor opportunity while expanding energy access for public facilities in a sustainable way. This bundled approach creates portfolios large enough to appeal to institutional investors, while including relatively small projects that often struggle to access affordable funding. Green Street, in close coordination with local agencies, identifies solar installation sites that are likely to succeed. Green Street then pre-develops those sites, resulting in a shovel-ready clean energy portfolio that can be tendered to a developer to build and operate. Along with the portfolio development rights, the developer gains access to a local currency bond, sold to local investors to fund project construction. The bonds and energy supply contracts are backed by guarantees to further reduce risk to institutional investors. By including operations and maintenance in facilities' energy supply contracts, Green Street's model also ensures that new distributed generation stays online for its entire useful life, creating long-term value for both the developer and the public facility. Green Street's development model also becomes more efficient over time, allowing subsequent portfolios to be developed with less time and money. An initial pilot is planned with Nigeria's Rural Electrification Fund. Under the pilot, Green Street will create reliable solar energy for up to 6 hospitals and healthcare facilities that currently rely on diesel generators. Within 5 years of initial deployment in Nigeria, the lab estimates that Green Street can drive the development of more than 150 megawatts of distributed solar. This would eliminate over 40,000 metric tons of carbon dioxide emissions per year, while also reducing both local air pollution and high energy costs associated with diesel generators. Over time, the Green Street model has the potential to bring reliable, clean solar energy for public facilities in both urban and rural areas. By doing so, Green Street Africa will improve health and education outcomes for millions, a crucial component needed for communities to break the cycle of poverty, while also driving stable, sustainable returns for local investors and stakeholders.